Sometimes, you know, what else can we do when we're feeling low? So take a deep breath and let it go. You shouldn't be drowning on your own.
The urinary system, also known as the renal system, consists of the kidneys, ureters, bladder, and the urethra. Each kidney consists of millions of functional units called nephrons. The purpose of the renal system is to eliminate waste from the body, regulate blood volume and blood pressure, control levels of electrolytes and metabolites, and regulate blood pH. The kidneys have an extensive blood supply via the renal arteries, which leave the kidneys via the renal vein. Following filtration of blood and further processing, wastes exit the kidney via the ureters, tubes made of smooth muscle fibers that propel urine towards the urinary bladder, where it is stored and subsequently expelled from the body by urination. The female and male urinary system are very similar, differing only in the length of the urethra. If you're a woman, your chance of getting a urinary tract infection or UTI is very high. Some experts rank your lifetime risk of getting one as high as 1 in 2, with many women having repeat infections, sometimes for years on end. To identify a UTI, keep an eye out for the following symptoms: a burning feeling when you urinate, a frequent or intense urge to urinate even though little comes out when you do, pain or pressure in your back or lower abdomen, cloudy, dark, bloody, or strange-smelling urine, feeling tired or shaky, fever or chills, a sign the infection may have reached your kidneys.
Anong nature, doc, and cause consistent?
Urinary tract infection is two types siya. It's an upper and lower respiratory tract infection. Pero common ang lower respiratory tract infection. So, most common cause is bacterial infection. So, ang lower respiratory tract infection, may mga symptoms is like difficulty in urination, tapos may mga flank pain. Pag upper respiratory tract infection naman, the most common is tummy pain, kaya upper na siya. And then fever and chill. So, most common in women na siya, especially sa adolescents or menstruating women. Kaya siya, sometimes na delayed ang you control the schedule of urination sa office or school or something. So, hygiene, second, hygiene is also called sexually transmitted disease through sex, and some related na sa food. Nag-infection, it goes to your kidney. Uncomplicated naman is sometimes caused by some infection in the upper area, like the tonsillitis. It can goes down to the lower tract. So it is also less common on male. Kaya mga male, so common sa male sa old age, those have prostate problem. They cannot control their urination. So, sa male na siya common, sa matigulang, sa old age siya. Pero sa mga young, hindi siya common. So, ano tagit?
May mga signs and symptoms, doc, before.
So, most common is flank pain.
Okay.
The pain on the back. Sa ibang hypogastric pain. So, pag upper naman siya ng UTI, may fever and chill siya. So, on iban, there is a redness in the urination, hematuria na otherwise. So, ang urine mo may lugoris color. Sa uncomplicated UTI, there's a pus. So, may mga lana na siya. Symptoms ng UTI.
what are, Doc, ang mga treatment sa
Treatment, the most it is caused by bacteria, so the antibiotic. Tapos hygiene,
proper hygiene?
hygiene naman siya. So, tapos water therapy to cleanse your kidney. Tapos limit lang mga
So-
junk foods or soft drinks or any so make your urine alkaline. Ito masigdik ng urine. High risk ka to develop bacteria. So, kung acidic ka, ang bacteria will form. Pag alkaline ka, hindi sila mabuhi. So, hygiene and treatment is the
Mga pilaman, Doc, ang time or pila ka weeks natin mag-ayo ng isa ka patient kung hindi magkato.
Basta you kill the bacteria in 7 days, but you will feel relief in the third day, third to the fourth day. Pero dapat complete antibiotic. Tapos lagi nalipong lang siya in 3 days time. So ayaw ka na lang. But the bacteria is still alive, nalipong lang. So you have to complete for 7 days para makaroon siya.
Ano, Doc, ang mga bal mo sa mga person, sa mga tao nga suffer sa UTI as of now? May ka message sa ila.
So
Para
if there is an urge to urinate, you go to the bathroom, don't control your urination, limit acidic drinks, so water therapy, good hygiene.
Thank you, Doc. Thank you so much.
I am a patient with urinary tract infection. The signs and symptoms of my disease were fever, lower back pain, frequent urination, and difficulty in urination. First, I didn't know that I have this kind of disease until all the signs and symptoms came out. For me, the nature or cause of my disease was improper hygiene and not drinking enough water. After experiencing the signs and symptoms of my disease, I have consulted a medical personnel to confirm what disease it is. Now, I was prescribed by my doctor to drink medicines and drink more water. I took medicines and followed the water therapy as recommended by my doctor. After I had followed the medicine and treatment, I realized that I didn't have any more fever and the lower back pain that I felt was eased. I have encountered some problems during treatment, like it is hard for me to develop the habit of drinking water and also the habit of good hygiene. And I always keep forgetting to drink my medicines and to bring water bottles with me all the time.
We are encouraging the patient to join the Sons and Daughters Encounter, also known as SAID, for her to have a healthy spiritual life, likewise for her to have a healthy and good life in the future. SAID is also related to the Christian family movement. SAID is a community wherein it caters the needs of those who are spiritually poor. It gives recollections and retreats for those who wanted to have it. According to the results of the survey that we have collected, there are 8 respondents who suffered from respiratory diseases, 4 respondents from those who suffered nervous system diseases, 5 from diseases in relation to the urinary system, 2 from the diseases in relation to the digestive system, and one who suffered a disease from circulatory system.
Wherever you go,